Okay, so we are going to be talking about the role of the pharmacist in educating patients on cardiovascular disease. Every year, 2,200 people die of cardiovascular disease, which is nearly 800,000 Americans each year, and it is the #1 cause of death in the U.S., and as a result, the national cost each year in healthcare is around $312.6 billion, so cardiovascular disease does have a huge impact on our healthcare system. So what causes cardiovascular disease? Things like smoking, family history of cardiovascular disease, age, lack of exercise, obesity, lack of a healthy diet, and also things like high blood pressure and high cholesterol. These can lead to things like heart attack, coronary artery disease, stroke, or an aortic aneurysm, which are all types of cardiovascular disease. So what impact do pharmacists have? Some of the major questions that we wanted to answer in this presentation were, do pharmacists have an impact on medication adherence and management? How has disease management after discharge from hospitals affected patients with cardiovascular disease? Does pharmacist feedback to other healthcare professionals have any effect on the outcome of cardiovascular disease? And what can be done to further promote patient education on cardiovascular disease? Patients not adhering to their cardiovascular medications contributes to this significant health problem, but those who adhere to their medications have a much lower chance of developing a cardiovascular problem than those who do not adhere to their medications. It has been shown that pharmacists have a positive impact on managing cardiovascular disease, and this was shown to come from patient education on cardiovascular medications and improvements in medication adherence. Pharmacists also increase outcomes of patient discharge from hospitals due to cardiovascular disease. They work with other health professionals to ensure that the patient is receiving the appropriate medication for their heart problem, and they educate the patients about their new medications that they will be taking. And pharmacists also make any necessary changes to the patient's medications while they're in the hospital. And when working with collaborative care teams, pharmacists are able to more precisely manage the patient's medications for better health outcomes. And this term is called collaborative drug therapy management, and it is crucial. It really is a crucial component in the overall health outcomes of patients with heart disease. And pharmacists work with physicians, and they take responsibility for administering medications. They do dosing adjustments, they order lab tests, and they monitor drugs for effectiveness and safety. So what else can be done? It has been shown that pharmacists do have a positive impact on patients with cardiovascular disease, but what can be done to further promote patient education and medication management? The first step would be to increase the patient education that pharmacists give on primary prevention methods. Like things like primary prevention methods are things like a healthy diet and not smoking. And also encouraging patients to get regular blood pressure checks is beneficial for cardiovascular health. And a lot more people have access to apps on their phones now, and they can use apps like iPharmacy to provide reminders of when to take medications and to organize if they're taking multiple medications. So pharmacists do have a major impact. Cardiovascular disease is a major concern for our healthcare system, and pharmacists are able to educate patients in order to prevent and manage cardiovascular disease.